What's up, Mom Nation? Hey, everybody. We are back with another. Blah, blah, blah. Okay, let's try that again, Katie. My words tried to come out a little bit faster than my mouth and tongue works. And we are back with another episode of Live and Learn. And we have a returning guest who we all know and love. It is Rebecca Engel with Beloved Motherhood, our favorite doula. And we are going to talk boobies. Well, not necessarily. We're going to talk breastfeeding. I know that this is something that a lot of moms struggle with. Rebecca, you're actually a breastfeeding coach, right? So you probably know more than I do about how much moms struggle with this. And then on the other side of the coin, how easy it can be for others.
Yes, so I am a certified breastfeeding counselor in addition to my birth and postpartum doula work. And I am also currently working on obtaining my military lactation consultant certification as well. So
Cool.
that's a lot of fun.
Oh, that's awesome. Well, let's dive right into it. Obviously, this is a very natural thing. Our bodies wouldn't create something like this if, it wasn't something that our babies need. So give me some background on that, or maybe talk me through what you say to your moms, your new moms, when they hire you to help them through this. Because
Mhm.
I was telling you before we hopped on the show, I had a very terrible experience with this. I so wish that I would have known you 10 years ago because I feel like my experience would have been better. But I was very turned off
Mhm.
from breastfeeding for a couple of different reasons. The first one specifically is he had trouble latching. Now, I did not know that he had a lip tie. So that's a thing. Maybe you can talk a little bit about that. Um,
Mhm.
but when I was in the hospital, my PM nurse was all about the breastfeeding. Don't give him even a pacifier, nothing. Like just try, 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 try. She even helped me to try to get him to
Mhm.
latch and all that. So she was really helpful. But my AM nurse was like, nope, kid's got to eat. That's basically my job. I don't care. Here's the formula, shove it in his mouth, away we go. So I kind of got mixed messages when I was in the
Mhm.
hospital.
Yeah, so it sounds like you got like both sides of the coin. You got one that was like breast is best and one that was like fed is best. There was like no middle ground for you.
No, no. And it was
So,
frustrating too, because again, didn't find out he had the lip tie until I had stopped breastfeeding and dried up and we weren't going back. Um,
hmm
and that was really sad for me because I did want to do it. And
hmm
I just felt like I was defeated over and over. And when you're a new mom, and to begin with, and you have a newborn, you have all of these emotions and all of the stress kind of flooding in. To add something else on top of it was like the straw that broke the camel's back.
Yeah, and that sounds like it would be very difficult because, like you said, you were getting mixed messages from both of these viewpoints on breastfeeding, and he wasn't latching, and you didn't know why because you guys didn't know about tongue ties and lip ties and all that stuff beforehand. And it sounds very, very frustrating. And it's like, why can't my body do this if this is something that comes naturally for us? So, like, I can touch on like so many different things with that one story. But I like to preface with my clients when they come to me so disheartened about like why is this not working for me? And I tell them like just because breastfeeding is natural, it is natural. Our bodies were created to create and sustain life. They were created to do that. But just because it's natural does not mean that it comes naturally
Right.
for the baby or for you even because like I mean breastfeeding looks easy. Put the baby on the boob and drinks and it looks easy and it's simple in that, but it's not easy. It's really not because if you think about it, for the last 9 months your baby has been feeding through essentially a tube with the umbilical cord, so your baby doesn't even really know how to use their mouth.
Right.
And if your baby has a tongue and a lip tie like your baby did, and chances are, so when you see a lip tie, more often than not you have a tongue tie.
Ah,
So
okay.
if you have a tongue tie, you don't always have a lip tie, but if you have a lip tie, chances are you most likely have a tongue tie. They normally go hand in hand. And so when your baby is tied either in their underneath their tongue or in their lip, that makes it even more difficult for them to learn how to use the muscles that they need to use in order to properly latch and breastfeed.
Hmm.
And so that's really hard, like on the baby, but then it's also hard on the mom because that causes like breastfeeding pain. It causes confusion. it causes frustration, and all of that really mixed with those baby blues hormones and those afterbirth hormones can really cause a mom to go downhill. And that is actually what affects the supply, because the supply is created by the hormones oxytocin and prolactin. And so without those two hormones, you're not going to be able to create milk.
Hmm.
Oxytocin is it's one of our many happy hormones. I've heard other doulas call it the mend and befriend gene, right? It's the hormone that you get when you give your friend a really big hug, right?
Hmm.
And when you're stressed, your body's creating cortisol. Your body cannot create cortisol and oxytocin at the same time. It is impossible for your body to do that. So when you're creating cortisol because of the confusion and the pain and the frustration of your baby just constantly crying because they're not getting enough milk,
Hmm.
it causes your supply to go down. And then mom's like, I don't know what I'm doing wrong, right? And a lot of times the moms aren't doing anything wrong. They're doing what they've been taught how to do.
Right.
And that can be very difficult for a mom to come across when she's like, I'm doing everything right. Why is this not working? Right. And so there's like just briefly to touch on the tongue and the lip tie, there's four different degrees of a tongue tie. There's a first degree, second degree, third degree, and fourth degree. And now those don't really, they're not measured in like severity. They're measured in the placement of the tie. First degree ties are the ones where pediatricians, doctors, they will see that and they'll be like, that needs to be resolved right away. And that's when the tip of the tongue is tied down. Baby has no access to be able to use the tongue at all. Second degree is a little bit more back, and third and fourth degree are what is called posterior ties. So they're way back here in the back of the tongue, which a lot of pediatricians, when they feel a baby for a tie, they'll say he has a small tie, but it shouldn't affect breastfeeding. One question that I like my clients to really think about when they're told that is, how long did that pediatrician actually watch you nurse?
Mm.
How does that pediatrician know whether or not it's affecting your breastfeeding journey if they didn't watch you nurse?
Hmm.
Because even though you can learn how to work with a posterior tie, it doesn't mean it's not affecting it. Does that make sense?
Hmm.
So a lot of people will actually compare ties with like finger webbing. So like a finger webbing up to here will be like a first degree. Right here will be a second degree. Right here will be a third degree. And down here will be a fourth degree. So as you know, like if you have like a third degree finger webbing, like right here, you can learn how to use the rest of your fingers, right?
Hmm.
But it's going to be a little bit harder. And that's what it is like with ties. So I always recommend that when they come across a lot of breastfeeding pain or the baby's not latching properly, I do recommend a tongue tie evaluation from someone who has been certified in tongue ties and lip ties. Because pediatricians, as awesome as they are, and I love my pediatrician, I love like all pediatricians really, they're not really trained in that, right?
Hmm.
And so they know what to feel for, but they don't really know how it affects breastfeeding.
Hmm. Yeah,
And
that
then
makes
on the flip,
sense. And oh,
yeah.
sorry, didn't mean to cut you off there.
No, go ahead.
And you brought up pain. Now, I
Hmm.
experienced pain because obviously I wasn't doing it right, or it was a combination of things because we had the tie issue that
Hmm.
I didn't know about. But it's not supposed to be painful, right? Like I feel like there are some moms out there that just think that it's painful and therefore that's their experience and they think that's normal.
Oh, for sure. And no, it's not supposed to be painful. So breastfeeding should not be painful at all. Like I want to blanket that for everybody. I know I see that too. I see a lot of moms on comments on Facebook posts where they're like, it is so painful to breastfeed. I don't know. And then I see a lot of comments saying, oh, your baby's still young. It's normal for it to be painful. It's not normal for it to be painful. When your body is experiencing pain in general, that means something is wrong. The
Right.
same goes for breastfeeding. It is common, and that's why people think it's normal. It is normal maybe to have some sensitivity, maybe a little uncomfortableness, especially when you start feeling some of the mature milk transitioning and the engorgement and the sensitivity because of the hormones. So uncomfortable, yes, that is normal to come across. If you're experiencing actual pain, that is your body telling you that there is something wrong.
Hmm.
Another way to really see that when I get called because someone tells me, hey, I'm experiencing a lot of pain and I don't know what's going on, the first thing I do is I look at where the baby is latching. If the baby is latching on the areola or right below the areola, or if you have small areolas above the areola, you shouldn't be experiencing pain at all. Most of the time, when moms feel pain, it's because the baby is latching onto the nipple itself.
Ah,
And yes, and so I like to tell people it's called breastfeeding because you're feeding from the breast. It's not called nipple feeding. We don't want to feed the baby from our nipple.
right.
A good analogy that I use is imagine that you're drinking out of a cup with a straw, right? The cup is your breast and the straw is the nipple. If you bite down on that straw, you're not going to get a lot of whatever it is you're drinking, water, soda, milk, anything, right? And that's what the baby is doing. They're clamping down onto that nipple, which is causing you pain and causing the baby frustration because they're trying to squeeze out milk through where the milk is supposed to be coming out of, but it's pinched.
Hmm.
Um, so if anyone who's watching, and Katie, you can also go ahead and do this. You take the tongue, the tip of your tongue, put it on the roof of your mouth right behind your teeth, and then move it all the way back until you feel your soft palate where it starts getting soft on the top of your mouth.
Hmm.
Feel that? You feel how far back that is?
Hmm.
How far back we want your nipple.
Oh, wow.
Yeah.
That is far back.
So, yeah. So, what causes breastfeeding pain is when the nipple is being squeezed between the tongue muscles and the hard palate of the baby's mouth.
Gotcha.
So we want enough of the breast in the baby's mouth where the nipple is towards the back of the soft palate, and that's where you're not going to experience pain. That's also where it's going to get rid of any nipple damage that you have, because nipple damage will also cause you pain. That is also not normal. Cracked nipples, bleeding nipples, not normal. People say it's normal because your baby's mouth is wet, and then when the baby's done nursing, it's in a dry area and it just dries out the nipple. That's not normal. You don't want nipple damage.
Yeah, no kidding. Absolutely. That sounds super painful. That was
Mhm,
really helpful. And I appreciate how in depth that you went. And it definitely was news to me that it had to be that far into their mouths. See, I didn't even know that.
mhm.
And I mean, granted, it's been 10 years since I've had a newborn, but that's something that totally would have remembered had
Mhm.
somebody tipped me off to that. And, I suppose I could have researched it as well, but I feel like there's so much information out there. And when you're a new mom, it's overwhelming to begin with, and it's just hard to know like what you should be paying attention to and what you shouldn't be. So bless you for being an amazing coach and for helping moms know what they really should be focused on and what the actual
Mhm.
reality is. There's another topic that you wanted to bring up that I cannot pronounce. I don't even know what this is, so I'm gonna let you go ahead and take it away.
Yeah, so when your baby isn't latching properly, your baby's not getting the milk. And when your baby's not getting the milk, your body starts to trigger to your breast what's called a milk inhibiting enzyme if your breasts get too full. And that causes a dip in supply. So that's what you're going to see a lot commonly when in like the Facebook posts where moms are like, I've lost my supply and stuff like that. That's really what they mean is they've noticed a dip in supply and they're asking for resources. And a lot of moms, bless their hearts, want to help everybody. And so they start telling them about stuff like fenugreek or other kind of supplements or lactation cookies, lactation drinks, lactation brownies, all the fun lactation stuffs, right?
Mhm.
Those are called galactagogues. And I
That's the
love that
word.
word. Yeah. I love that word because for some reason it gives me like Star Wars vibes.
It does.
But those are called the category of those are called galactagogues. And the theory behind them is that they help boost your supply. Now, one thing that I do want to let people know is they do help in a way, but not the way that you think. Okay. So that's kind of why I wanted to bring it up to bring more awareness to it, because I know a lot of moms really rely on that. And then some moms who use all of those and they still don't see an uptick in supply get really discouraged. So I want to kind of
Yeah.
explain why that happens. Galactagogues are, like I said, supplements and all the fun lactation stuffs that are supposed to up your supply. Nothing increases milk supply. Nothing increases milk supply except for your baby's ability to get the milk out. or your pump's ability to get the milk out.
Got it.
Kind of, yes. So it's kind of like if you think of a glass again. If you fill the glass all the way up, you can't fill it up anymore, right? It'll spill
Mhm.
out. If you drink the water, then you can fill it back up. That's what your breasts are doing.
Gotcha.
Once your breasts are super full, you'll start experiencing like those leaks and stuff like that. Your body will create, like I mentioned, a milk inhibiting enzyme that says, stop production. We don't need any more milk. That is what is causing the dip in supply. The
Mm,
best way to uptick your supply is to feed on demand, pump a little bit more often if you can, and try to figure out why your baby is not efficiently feeding. Now, if your baby is not efficiently feeding, it can be a latch issue, it can be a tie issue, it can be any of those things. Now, if you've gone all those routes and you're still not seeing an uptick in supply, you may have a glandular tissue issue with the glandular tissues in the breast is what helps create the milk. If you don't have enough glandular tissue, then that could be what's causing you to not have much of a milk supply.
got it.
Medical stuff like PCOS, thyroid issues, those can also affect milk supply as well. But just staying away from the medical side and on the general topic, because you can go into rabbit trails on those things too.
Yeah.
You want to focus mostly on trying to get that milk out. The more milk you get out, the more milk you will produce. Now, the galactagogues, they do help because they give moms a sense of relief and calm. Moms believe that they work, and there is a lot of power in belief,
Yep.
right? When you believe that what you're using is working, you feel more calm, your oxytocin is going, you're not producing cortisol because you're not as stressed about it. And that's what's helping your milk to flow some more and produce some more. So they are good. I'm not saying don't use any of them. I'm not saying they're bad. I'm saying if you're not seeing them working, start looking in other areas, right? Um, People will recommend eating more protein, drinking more water. That doesn't up your supply either. Your diet, your water intake will help support your supply. It will keep it going. It will not help make it increase though.
Got it.
And I feel like that's a really big myth out there right now
Giant.
that all these different things are what's increasing supply. But really what you need oxytocin, you need prolactin, and you need to get that milk out. And that's what's really going to help up your supply some more, unless there is a medical reason behind it.
Thank you for clarifying and simplifying that
Mhm.
because I just, the whole world of breastfeeding to me was like an unknown, you know? I mean, I had a kid at 30, nearly 35 years old. So I lived a lot of life not in the kid world. And
Mhm.
so I don't know why I didn't research more on that or seek some support on that. I really don't know why. I wish that I could put myself back in the mindset that I was in because I feel like I'm a pretty resourceful girl, you know? Like, why
Mhm.
didn't I reach out for help? I'm usually really good about that. So it's good to know. And again, I wish that I had you back then, but I feel like it's really good for our moms and our listeners to know that people like you exist and that
Oh,
you
for
can
sure.
get help and you can get
Mhm.
one-on-one coaching. Now, you tell me just a little bit about the support that you offer to moms in terms of breastfeeding. Do you come to them? Like, what does that look like?
So my breastfeeding counseling is in home. So like in your guys' home. I don't expect you to travel with like a 2-day old
Yeah, good.
to an office or something like that because I know that moms feel most comfortable in their own setting. If I'm going to watch that baby latch, I want to watch that baby latch in a setting where the mom is going to be latching that baby the most.
Yeah.
Because you'll get to doctor's offices a lot. Like it's happened to me with my own kids. Like they're coughing and throwing up and stuff like that. I get them in the doctor's office and they are completely fine.
Right? I
Right?
know. How does that happen?
Yeah, and that like really it frustrates me when that happens. And I want to try to make sure that moms don't feel like that. A lot of IBCLCs who are actually like higher than me, they do a lot of like the medical backgrounds and stuff like that. Some of them will come to your house, some of them will have you come to their office. I personally prefer going to my clients' houses because they need to learn how to make breastfeeding work for them where they're going to be breastfeeding. Does that
Mhm.
make sense?
Yeah,
If you
totally.
learn how to do it in an office that you're not going to be in 24/7, then how do you, it's a lot harder to transition that to your home, those
I agree.
techniques,
Yeah.
especially because those offices come equipped with like the proper breastfeeding pillows and stuff like that, and you may not have that at home.
Right.
So I like to use what the client has. So my breastfeeding counseling I do in home. I travel to you. I do 2 hour consultations because it's really hard to watch a baby feed and then offer adjustments and information in just like 1 hour or less.
Right.
So
You
I do
gotta,
two
yeah.
hours. Yeah. I'm also not contract based. So if you need one consult and then and that sets you off on like the perfect breastfeeding journey, then that's really all you need. Then that's all you need to get from me. I don't require coming in. Now I will do follow-ups if needed, and I will check in with you through text and everything to make sure everything's going well. But but I don't have like a contract where you have to come see me every couple weeks,
Oh, that's
right?
good. Well, that's really good to know because I feel like, and you could probably tell me more because you have more experience, but I
Mhm.
feel like moms are on all different levels with this. Like you've got
Mhm.
the me that was clueless and you know, and then you've got moms that maybe this is their second child. So they've kind of been here
Mhm.
before. They just need a couple of tips or a little extra coaching, whatever it is. I just feel
Right.
like moms are on all different levels. And so it's kind of nice to offer that flexibility. I appreciate that.
Yeah, yeah, and I love that you appreciate it, and I hope, my mom's appreciate it too and stuff, but I know that I feel like that's really important to moms is that, especially when you have a newborn, right? What I do in those consultations, so like I mentioned, they're 2 hours long. I'll get some background information about you. If you have breastfed before, I'll get some background information on your previous breastfeeding journeys, and then I'll ask you what's going on with your baby specifically. I do normally ask that the like moms don't feed their babies about an hour and a half to an hour before I come, because if the baby is fed right before I come, I'm not going to be able to see them latch. If they're fed like 3 hours before, then they're going to be too frustrated to latch while I'm
Yeah.
there. So
Yeah.
I kind of find that sweet spot between like an hour and a half to an hour. So then I'll get the background information, I'll talk to you about what's going on, see where everything is going, and just kind of be there to listen in that moment. And then I will watch you latch your baby. And when I watch you feed your baby, what I'm looking for is I'm looking for signs of a secure latch as well as a deep latch. I'm looking for gulping signs to make sure the baby's actually gulping and not just and having nutritive sucking versus like comfort sucking.
Hmm.
And then if I start seeing any signs of maybe tongue and lip ties, since I am not an IBCLC, I do want to preface this. Since I'm not an IBCLC, which that, in case anyone doesn't know, that stands for International Board Certified Lactation Consultant. They're like the higher ups of the lactation world.
That's a
I
mouthful.
cannot, yeah, it is. I cannot officially diagnose a tie, right? I'm not allowed to diagnose anything because I'm not a medical professional.
Right.
However, I've worked with a lot of moms who have had ties, and my own children have had ties. So I know what to look for. I know what they feel like, and I know what sucking feels like with them, and I know what sucking feels like without them.
Hmm.
So I will also, if I feel like there is a tie issue going on, I will look at for that as well. And then I will give you a referral to someone who can officially diagnose and help you resolve any of those tie issues. And
That's
then after
giant.
that, yeah, it's
How
huge.
many babies do you say like percentage wise you run into that have that situation?
Oh, probably like almost all of them. So what people don't
Yeah.
know about tongue and lip ties is tongue and lip ties are actually genetic.
Oh,
They're
okay.
genetic. They don't just happen. So
I blame my
chances are if
husband.
you're
I don't have that.
So chances are, if you or your husband have a tongue or a lip tie, or the older siblings have a tongue or lip tie, your baby probably most likely has a tongue or lip tie.
Yeah.
Now, it's rare to get a baby with a first degree tongue tie, which is where the tip of the tongue is actually tied down.
Hmm.
But like I have both a tongue and a lip tie. I actually learned this when I was learning about tongue and lip ties. That's where the gap in my teeth comes from
Yep, is your
because
lip tie.
yeah, or
I
my lip
have a
tie.
little one too.
Yeah.
Yeah. Anyway,
Yeah.
so I am lip
But
tied. So it's not my husband's fault. That was a lie.
okay. You're like, hubby, if you're listening, I take full responsibility. What people don't know, though, because a lot of people are really hesitant when it comes to tongue and lip ties because they think they're being overdiagnosed right now, is like an easy way out. What people don't know is we've actually been diagnosing tongue and lip ties long before contemporary medicine has actually come around, the Western medicine and everything. Traditional midwives and stuff, that was all in their literature was about tongue and lip ties.
Mm,
It fell out of the literature when Western medicine started taking over and we started like getting all the hospitals and stuff like that. It fell out of literature. I don't know why, but that's why people don't look for them. That's why people stopped looking for them until just recently when it came back. And that's also why a lot of our moms and grandmas had very painful breastfeeding journeys
yeah.
because they didn't know about them. And so then when we have our breastfeeding journeys, our moms, our grandmas, our aunts, and all of our older friends and relatives, they all say, well, it was painful for me too, so that's normal. And that's where we get that myth that it's normal for breastfeeding to be painful.
Makes a lot of sense. I learned so much in this last, whatever, how long we've been on, 25 minutes or whatever it is,
Mhm.
than I learned the entire time I had my newborn. Seriously. So thank you. And thank you for being so
Sure.
generous with your knowledge and your experience and sharing that with our mom community. And for those of you out there who maybe, maybe you're pregnant right now, you're a first time mama, contact Becca. She is the absolute sweetest. She will help you out. She's very knowledgeable, as you can tell. Becca, how
Thank you.
can you're welcome. I know you, and I know this. I know this to be true. How can our mamas find you?
So you can find me, the best way to find me right now is on Facebook at Beloved Motherhood. You can find me that way, or you can shoot me a text or give me a phone call. And we can put my phone number up in the show notes if you want, Katie.
Absolutely.
You can also email me at info@familyblessingsaz.com. I am in the process of changing that domain, which is why it's different because of my brand change right now. But that email is still active, so you can still use it if you prefer to email. But most of the time, I'm on Facebook. You can find me from my personal profile, my business profile, or shoot me a text, and those are probably the easiest ways to get a hold of me.
Yay. Well, thank you so much, Rebecca. Because we know each other, I call her Becca. So I'm so sorry. I'm probably confusing people out there, but it is Rebecca with Beloved Motherhood. Thank you so much for being with us. I know time is precious, and I absolutely appreciate you spending your precious time with us and filling us with so much knowledge about this topic that I don't think very many people know a lot about. So thank you very kindly for being here with us,
Of
my dear.
course. Well, thank you for having me. This is fun. I love talking about this kind of stuff.
I could tell. I could totally tell. That's great. Well, hey, when you do what you love what you do. It's a magical
Exactly.
thing. So I love that and I love to hear that. If you guys want to check out any of our previous Live and Learn episodes where we have a member from our group, mostly, sometimes we have some members from that are not in the group that come on and teach us something. It's like a piece of specialized knowledge or something that we can implement right away is really what we learned here on Live and Learn. And that is what we did today with Becca with Beloved Motherhood. So if you want to check out any of our previous episodes, we have a variety of topics. Hop on over to our YouTube channel. It is at Mom Nation USA. That's our handle. If you prefer to listen to the podcast type or podcast version, then hop on over to your favorite podcast platform and do a quick search for Mom Nation Talk Radio. There you will be able to connect with all of our shows here at Mom Nation, including a few old ones with Becca, because she's a returning guest.
Yes.
All right, guys,
It's
we'll
always
see
so,
you.
it's always so fun.
It is.
Bye, guys.
Bye.